Welcome to the training on the Inventory for Client and Agency Planning, also known as the ICAP.
This tool will assist in determining if a person meets eligibility requirements for the ID and LAH or the CWP waiver programs. Please note the ICAP is not a historical document. It is used as a point-in-time measurement of current skills and behavior. It is the role of the support coordinator to administer the ICAP.
ADMH Administrative Code on eligibility and level of care determination for Medicaid waiver programs include the ICAP, which is the standard functional assessment instrument used in the process of determining eligibility for the waiver programs. This commercial product will produce a 3-page summary report known as the CompuScore. An eligibility assessment within the Alabama Division of Developmental Disabilities Information System, also known as ADIDIS, summarizes key information from the ICAP CompuScore, from which regional office can determine the person's level of care. Eligibility for the waiver and clinical evidence. An ICAP CompuScore report completed within 90 days prior to the application to be added to the waiting list. Initial enrollment. Information from an ICAP administered within 90 days prior to the date of the waiver application. The ICAP CompuScore report is required. Other assessments, such as the Vineland or Adaptive Behavior Scale, may be used to supplement the information provided by the ICAP. At annual eligibility and redetermination. The ICAP is administered within the previous 24 months, including notation that the assessment has been reviewed and that all information remains the same. If information has changed, a new ICAP must be administered.
ADMH Operational Guideline 1.3 for Client and Agency Planning for Community Services. When to administer the ICAP. Upon referral from ADMH of an applicant for the waiver, administration must occur within 90 days of application submission to the Regional Community Services Office for a determination of eligibility. It is administered every 2 years at redetermination of eligibility, or any time information regarding the person served has changed significantly. Examples of this include increases in maladaptive behaviors or somebody who has maybe declined medically. During the administration, the support coordinator is responsible for administering the assessment. The support coordinator is to interview the applicant or person served and/or a caregiver most familiar with the capabilities of the person served, such as someone who has close daily involvement. The support coordinator must complete the ICAP. The ICAP is never to be given to a provider, staff person, or family member to complete on their own. Following administration of the ICAP, the applicable scores yielded by the ICAP administration are entered into the eligibility assessment via ADIDIS. The completed ICAP protocol is scanned and uploaded to the record of the applicant or person served via ADIDIS. There's a difference between reviewing and updating at redetermination. If it has been determined that updating the ICAP is not necessary following review by the support coordinator, the support coordinator must initial and date the ICAP score sheet. This must be submitted with the redetermination packet. This should never occur more than one time in a 2-year period. The process for reviewing the ICAP at redetermination. Following your observations and communication with family, the provider agency, or a person who knows the individual best, you will review sections A, B, and C to determine if this information has changed. The support coordinator will also review the most recent quarterly report, the behavior support plan, if this applies, and recent behavioral data, again if this applies. If it has been determined there are no significant changes in the last year, the support coordinator will write on the booklet and the CompuScore printout as follows. You will update sections A, B, and C. Again, this is if it applies. Examples of this would be changes in weight, changes in medications, or if any other additional diagnoses have been added. You will write in the date of review. This will be the same day as the PCP annual meeting. You will initial the booklet and CompuScore printout. This will then be uploaded into ADIDIS. Please note that these are the minimum expectations when reviewing the ICAP. The support coordinator may have to obtain other sources of information to determine if this assessment should be re-administered.
The adaptive behavior domains included in the ICAP are motor, social and communication, personal living, and community living. This is an example of this front scoring sheet of the booklet. This is where the support coordinator will enter in the demographics. It's very important to complete this form with accurate information. This will be the next page in the ICAP booklet. This is where the support coordinator will fill out the descriptive information, so information that is current at the time of the assessment, the diagnostic status, which will include primary diagnosis as indicated by a professional evaluation, and any additional diagnosed conditions as indicated by a professional evaluation. There's also a comments box. We ask that you utilize this box if any additional pertinent information is available, such as conflicting diagnoses or active pending changes in legal status. The next page will outline functional limitations and needs. This is where you will include current functioning at the time of assessment. Be sure that the information you select reflects the actual medical documentation on file. And again, there's a comments box, and we ask that you include known medications and/or any additional information as it relates to the factors listed on this page. In scoring the ICAP, you'll score each item on a scale of 0 to 3. The score you provide will depend on the ability in performing the task independently with no assistance. The developmental statements begin with simple skills and progress to more and more difficult skills that a person learns and masters in development from infancy to adulthood. A score of 3 means they do very well. The skill is either mastered or they no longer perform it because it's too easy. They are able to independently perform all parts of the task without supervision or help, or performing all parts of the skill independently when appropriate with no more than an occasional request or prompt to begin the task. It's very important to know that a score of 3 can be yielded if an individual only needs an occasional request or prompt to begin. A score of 2 indicates they do fairly well, so they can perform the task when prompted, or it is performed around 75% or 3/4 of the time. The skill is performed fairly well around 3/4 of the time. The skill is performed without help 3/4 of the time. They can be reminded to complete the task, and they will do so approximately 3/4 of the time. A score of 1 will indicate that they may do this, but not very well. So they may perform the task when prompted around 25% of the time. The skill is performed, but not very well 25% of the time. The skill is performed without help 25% of the time. They can be reminded to complete the task, and they do so approximately 25% or 1/4 of the time. A score of 0 will yield rarely or never. This indicates that the task is just too hard. They are not permitted to perform the task due to safety concerns, or never or rarely perform all parts of the task, even if asked. Never or rarely perform the skill because they are too young. A score of 0 is automatic if there is an inability to perform all parts of the task. This is the page where you will identify if they are from 0 to 3 on their motor skills. When we're rating these skills, we always rate on current skills, and we want to rate on the best description of their present performance. Please note again that this information is not based on historical behavior. This is going to be what they currently are doing and what is currently observed. If the performance is unknown or it has not been observed, write on how well they could perform the task independently. This is the page for social and communication skills. And again, it's very important with all adaptive components of the assessment to rate on current skills, rate the best description of present performance, and if performance is unknown or you have not observed this, rate on how well they could perform the task. It is also very important to ensure that there is an answer for every numbered item. This is the page for personal living skills. Again, we're going to rate on current skills, what they're able to do now, best description of present performance, and if this is not something that has been observed, how well could they perform the task independently? Community living skills. We're going to continue to rate on current skills, and we're going to rate on the best description of present performance. And again, if the performance is unknown or has not been observed, rate on how well they could perform the task. There are several considerations to take when scoring items on the ICAP. If a discrepancy is identified in the quality of the performance on a task and frequency, the score should be based primarily on the quality. How well do they perform the task versus how often? We will score how well they will perform the task. If there is a refusal to complete a task, the score should be based on the frequency of the performance rather than the quality. So this is a little bit different than the example before. We're going to score based on how often they perform the task if there is a history of refusing to complete the task. If you were unable to score an item due to not observing the task being performed, or there is a lack of opportunity to perform the task, estimate how well they could perform the task without help. Do not leave any items blank. Do not mark more than one response for each item. When you are scoring someone who utilizes alternative communication, examples are communication books, boards, electronic devices, and American Sign Language can be considered equivalent to speaking if they contain words that would form a simple sentence. So for example, pointing to the word snack and please would constitute a simple request. Adaptive equipment. If the equipment is used to perform a task, score based on how the task is performed. Some additional considerations in each area of the ICAP when looking at motor skills. They do not need to have full use of both hands. One hand can be utilized. They can use hands or furniture to pull themselves up. If they are unable to physically pick up a pen, the score would be a 0. They are not required to obtain supplies. Community living. Trading money or items of value. The person should understand that he or she should not give up something for nothing. So for example, if a simple exchange of money for an item, if the person is unable to understand that you pay for something to get something, then you would not score that as a 3. Buying items from vending machines. When provided with the correct money, they place the money into the vending machine and it selects an item to purchase. If they are unable to make change from a $5 bill, then they will not have the skill to budget money. Steady pace on a job. If they do not have competitive employment, this score would be a 0. Social and communication skills. When a person does not have the physical ability to turn their head, but are able to acknowledge the speaker by sounds, gestures, or smiles, the score is a 3. For the hearing impaired, if the person looks towards someone who is waving, the score is a 3. If a person uses sign language to communicate at least 10 words, the score is a 3. If a person uses a communication device that has more than 10 symbols the person understands and uses, the score is a 3. Personal living skills. If the person can swallow food with consistency of ground, chopped, bite size, or the consistency of baby food, the score is a 3. If staff presence is needed to provide prompts as needed from an evaluation, the score is a 2. If staff presence is needed to provide the entire mealtime, the score is a 1. If the person washes their hair but does not rinse out the shampoo, the score is a 1. Drying hair can include towel dry. If prompts are needed to use an appropriate amount of shampoo or to cup it in their hand, the score is a 3. Heating up pre-made food in a microwave only is a score of 0. Now we're moving on to the Maladaptive Behavior Index. It's important to ask yourself this question: do they have a problem behavior that should be marked on the ICAP? A problem behavior requires that attention of others because that particular behavior should be minimized or eliminated. Problem behavior should only be indicated on the ICAP if it is one that must be addressed in order to stop, prevent, or redirect. A problem behavior is identified as one that interfered with a person's daily activities. If the problem behavior is not being addressed and no one is doing anything about it, this behavior is not listed as a problem behavior on the ICAP. Please do not take a laundry list of problem behaviors from the ICAP booklet to determine if there are problem behaviors that should be marked. The scoring should be based on behaviors that occurred in the last 90 days to determine frequency and severity. Consideration should be given to behaviors that occur less frequently, but that are severe in nature. These examples are assault, arson, rape, molestation, and theft. When scoring the Maladaptive Behavior Index, you're only going to mark one response indicating how often the primary problem behavior occurs. Please do not count potential occurrences, as this does not accurately reflect how often the primary problem behavior occurs. Frequency is very important to determine how often that occurs, daily versus weekly versus monthly. Only mark one response indicating how serious the primary behavior is when it occurs. Mark a 0 when it's not serious, not a problem. You would use this to rate the severity regardless of how often it occurs. The behavior should not be listed as a problem if you are marking it as a 0. Marking a 1, slightly serious, a mild problem. This usually happens in only one environment. The behavior is redirected, it is addressed informally, i.e., those who know him or her best are aware of the behavior and know how to intervene. The behavior can be managed in a structured environment without formal written procedures. If there is no behavior plan for the behavior, then that would be marked as a 1 because it is managed without formal written procedures. Mark a 2 when it's moderately serious, a moderate problem. This occurs in more than one environment. Formal intervention or redirection is utilized when this occurs, and the behavior is managed with formal written procedures to decrease the behavior and to teach a replacement behavior. These behaviors are documented. These will be your behaviors that are addressed in a behavior support plan, and data collection is taking place on the problem behavior. You would mark a 3 when a behavior is very serious and a severe problem. They have a behavior support plan approved by the appropriate committees that includes documented frequency and severity. The frequency of the behavior is reduced only with constant supervision. So they always have to have someone with them, and that is the only way that behavior frequency reduces. There is somebody with them present 24 hours a day. It is difficult for one person to control him or her when the behavior occurs. Physical restraint or intervention is required. A second person or staff is required to control them when the behavior occurs. A person or staff is unable to easily redirect them, and the result is harmful to them, harmful to others, and requires the involvement of law enforcement or hospitalization. If the behavior is easily redirected, it is not difficult for a single person or staff to control. You would mark a 4 if the behavior is extremely serious and a critical problem. Critical, immediate threat to the life of them or others, requiring immediate intervention. These examples are assault, murder, rape, arson, theft. They have a behavior support plan approved by the appropriate committees that includes documented frequency and severity. The Division of Developmental Disabilities has been informed of the seriousness of the behavior. They would require a highly restrictive environment with 24-hour supervision. This is what the page for problem behavior looks like. Number 1, hurtful to self, intentional acts, not thoughts or threats. It's very important to know that these are actual acts of being hurtful and not saying that they are going to hurt themselves. Hurtful to others. Again, intentional acts, not speaking and saying that they are going to harm somebody else. Destructive to property, intentional acts and not saying, I'm going to punch a hole in the wall. Those are going to be actually punching a hole in the wall. And disruptive behavior. These are behaviors that directly interfere with the activities of others. This isn't going to be your non-compliance or not following directions. These are going to be more of interrupting, yelling, screaming, interfering with the daily activities of themselves or others. Unusual or repetitive habits. These will be excessive actions that interfere with daily activities. And the key thing to think about is interfering with daily activities. Socially offensive behaviors. Those are going to be those that are offensive to the majority of others. Being vulgar, threatening, things that are going to cause issues in social situations. Withdrawal or inattentive behaviors. So they have difficulty being around other people. They're expressing suicidal ideations, showing very minimal interest in doing things, sleeping too much, always talking negatively. And then you have your uncooperative behavior. So this is going to be not following societal rules, directives, not compliant with medical treatment, cheating, stealing, refusing to go to work, refusing to attend work, or refusing to attend school. So those would be considered your uncooperative behaviors. And then at the bottom, there's a section where you'll fill out the response to problem behaviors in the 8 categories. And you'll read through those and you'll mark one thing that is the way that those around the individual respond when they engage in these behaviors.
In an effort to remove any related bias to the selection of services, the support coordinator will not complete this section during the administration of the assessment. When going in to enter in the numbers into the CompuScore, 0 should be entered for both of these sections. As stated on the previous slide, in order to remove any related bias in the selection of services, these sections will not be completed during administration. When the support coordinator goes to enter in the scores on the CompuScore, a 1 should be entered for these sections.
So service score, maladaptive score, and level of support. This is where it will summarize the scores of each section of the ICAP. The service score is a combination of the adaptive behavior, which has a 70% weight on the score, and the maladaptive score, which has a 30% weight, and the scores range from 0 to 100. The service score is an absolute cutoff. A score of 86 or above is considered ineligible. Service scores between 71 to 85 should be reviewed closely, and sometimes additional documentation may be requested. Service scores of 70 and below are presumed eligible. Please keep in mind that a high maladaptive behavior index artificially lowers the overall service score. It can make it look like there are overall adaptive deficits when there really is not. So for example, if someone has several severe problem behaviors and you have indicated that on the ICAP scoring sheet, that will depress the service score of the ICAP due to the problem behaviors. Always review those domain scores, especially if the Maladaptive Behavior Index is high. So this is an example of the sample score sheet. And at the bottom, you'll see the service score. And each service score is indicated from an evaluation date. And on this specific scoring sheet, there's 4 different evaluation dates. The main score you will look at is that service score at the bottom. And you can see in the column there's also something that says maladaptive behavior. And that is how much, when it says minus a number, that's how much it pulls down that service score. You also have the ICAP service score and level, and those scores are based on both adaptive behavior and problem behavior. They range from 20, which is level 1 total care, to 90, which is level 9, which means infrequent or no assistance for daily living. So this example has a score of 31 and a level 3, which requires extensive personal care and or constant supervision. Each domain has a cutoff score. For the self-care, the ICAP personal living domain score is less than 509 for persons age 17 or older. What that means is if someone's score is greater than 509, that they would fall outside of the range of the cutoff score, which could also deem them ineligible. Receptive and expressive language. The ICAP social communication domain score must be less than 515 for persons aged 17 or older. Again, that also indicates if someone's domain score is greater than 515, they could be considered ineligible. For mobility, this is determined by responses selected for items 9A and 9B of the eligibility assessment with regards to walking independently and what assistance or assistive devices are needed. Self-direction. The community living domain score is less than 514 for persons age 17 or older. The capacity for independent living, the ICAP broad independence score is less than 510. And the learning is as determined from the diagnosis record. So what these cutoff scores mean is that when you have a depressed ICAP score due to a maladaptive behavior index, it's important to go look at these domains and see what the scores are within the domains, and that will also assist with determining eligibility. There is different cutoff scores for persons who are aged between 4 and 17, and that's usually looking more specifically at specific items within the domains. But generally, you will look at the domain scores for each area to ensure that they fall within those cutoff scores in determining eligibility.
This chart is a condensed version of the information from the previous slide and can be used as a ready reference for the ICAP domain cutoff scores.